Well, good afternoon, everybody. I'm here in place of the President and CEO of our healthcare system. He really wanted to be here today. He's passionate about patient safety and has been a leader in our healthcare system. And he wanted to present the work of David Ballard, Don Kennelly, and Jan Compton in patient safety across the system. The system is Baylor, Scott, and White. We've just merged. Everybody seems to be getting together. We're one of the largest health systems now in Texas. And the journey they started a few years back is a journey to no preventable deaths, no preventable injuries, and no preventable risk. Very high bar to reach, but that's what I think we're here today to talk about. And this is the system. It's pretty big. 34,000 employees, 6,000 physicians, 43 hospitals. So it's quite an undertaking for these individuals to oversee quality and safety. And this is the vision, and they've got metrics in place to measure it. For deaths, the metric is the hospital standardized mortality ratio for Texas. For injuries, the metric is adverse event rate by using the global trigger tool. And you may hear a little bit more about that this afternoon. It's an audit method on a random sample of records. And for risk, the metric is patient safety surveys, patient and staff employee surveys. And we have this computerized system where you can have what we call MIDAS reports, where anybody can write in any adverse or potential risk to a patient. So that's the program elements: patient safety vision, the priority areas, focus, and it's all about safe processes of care, safety culture, safe technology, everything that we're talking about here at this meeting. Teamwork, training, education, and clinical decision support devices. And what drives it? Well, number one, a key driver is our senior executives. 15 to 20% of their incentive compensation results on outcomes of patient safety in reducing preventable harm, deaths, and risk. So they're incentivized very much to make this happen. Standardized order sets and expanded the RR team. And what did that result in? So far, a 39.5% reduction in hospital standardized mortality rate in 5 years. That's 9.6% per year, which calculates out to be 360 fewer deaths in the last 2.5 years. In 2005, we were way down in the hospital adjusted mortality rate for Texas. We're in the 50th percentile. Now we're up in the 90th. And we've had a 45% reduction in preventable hospital-acquired adverse events in the last 4 years. So we're very much committed to patient safety, and so I'm imparting the message. For those of you who want to read more about the way it's been addressed, there are a number of articles by David Ballard and Don Kennelly and Jan Compton published in the peer-reviewed literature that explains how they've got to the process so far. So with that, thank you all very much indeed. Thank you.